1. Omeprazole mechanism. Irreversibly inhibits the hydrogen, potassium, ATPase pump in gastric parietal cells. Indications: GERD, peptic ulcer disease, PUD, and H. pylori infections. Side effects: hypomagnesemia, C. diff-associated diarrhea, and increased risk of bone fractures. Nursing process: administer 30 to 60 minutes before meals. Monitor for persistent diarrhea. NCLEX tip: long-term use significantly increases the risk of osteoporosis. Memory trick: prazoles pumps down the acid. 2. Pantoprazole mechanism. Blocks gastric acid secretion. Indications: GERD and erosive esophagitis. Side effects: thrombophlebitis at the IV site, headache, and GI upset. Nursing process: do not crush or chew enteric-coated tablets. Check IV patency regularly. NCLEX tip: this is the most common PPI administered intravenously in hospital settings. Memory trick: pantoprazole paints the stomach wall. 3. Esomeprazole mechanism. Suppresses gastric acid by inhibiting the proton pump. Indications: Zollinger-Ellison syndrome and severe GERD. Side effects: vitamin B12 deficiency, with long-term use, and hypomagnesemia. Nursing process: monitor bone density and assess for occult blood in the stool. NCLEX tip: generally considered more potent than omeprazole for chronic conditions. Memory trick: esomeprazole equals extra strength. 4. Lansoprazole mechanism. Acid reducer. Indications: duodenal ulcers and GERD. Side effects: diarrhea, abdominal pain, and dizziness. Nursing process: for patients with dysphagia, capsules can be opened and sprinkled on applesauce. NCLEX tip: frequently used in pediatric patients for acid reflux. Memory trick: lansoprazole for little capsules, sprinkle. 5. Famotidine mechanism. Competitively blocks H2 receptors in parietal cells. Indications: gastric ulcers and heartburn. Side effects: confusion, especially in the elderly, and dizziness. Nursing process: give at bedtime or before meals for maximum effectiveness. NCLEX tip: preferred over cimetidine because it has significantly fewer drug interactions. Memory trick: famotidine fades the acid. 6. Cimetidine mechanism. Reduces gastric acid secretion volume. Indications: heartburn and acid indigestion. Side effects: gynecomastia, impotence, and mental confusion. Nursing process: high risk of drug-drug interactions via the 450 cypriot pounds enzyme system. NCLEX tip: always avoid in the elderly due to severe CNS side effects. Memory trick: cimetidine cements other drugs, inhibits their metabolism. 7. Ranitidine mechanism. Reduces gastric acid concentration. Indications: peptic ulcer disease and GERD. Side effects: nausea, constipation, and drowsiness. Nursing process: periodically monitor liver and kidney function tests. NCLEX tip: often used as a classic example of H2 blockers in exam questions. Memory trick: ranitidine, the acid, ran away. 8. Sucralfate mechanism. Forms a thick, protective paste, barrier, over ulcer sites. Indications: active duodenal ulcers. Side effects: constipation is the primary side effect. Nursing process: must be given on an empty stomach, at least 1 hour before meals. NCLEX tip: do not administer with antacids, it requires an acidic environment to activate. Memory trick: sucralfate seals the ulcer, sticky sucralfate. 9. Misoprostol mechanism. Prostaglandin analog that increases mucus and decreases acid. Indications: prevention of NSAID-induced gastric ulcers. Side effects: abdominal cramps, diarrhea, and uterine contractions. Nursing process: a negative pregnancy test is mandatory before starting therapy. NCLEX tip: strictly contraindicated in pregnancy, category X. Memory trick: misoprostaglandin protects the gut. 10. Aluminum hydroxide mechanism. Neutralizes existing gastric acid. Indications: PUD, GERD, and hyperphosphatemia in chronic kidney disease. Side effects: constipation and hypophosphatemia. Nursing process: monitor bowel sounds and encourage high fluid intake. NCLEX tip: used in renal patients to lower high phosphorus levels. Memory trick: ALU minimum, minimum bowel movements. 11. Magnesium hydroxide. Mechanism: antacid and osmotic laxative. Indications: constipation and dyspepsia. Side effects: diarrhea, hypermagnesemia, and dehydration. Nursing process: monitor for toxicity, look for absent deep tendon reflexes and hypotension. NCLEX tip: this medication is contraindicated in patients with renal failure. Memory trick: magnesium moves the stool. 12. Calcium carbonate. Mechanism: directly neutralizes gastric acid. Indications: heartburn and calcium deficiency. Side effects: rebound hyperacidity, kidney stones, and constipation. Nursing process: monitor for signs of hypercalcemia and give with a full glass of water. NCLEX tip: can cause acid rebound if the patient stops taking it suddenly. Memory trick: calcium calms the burn but clogs the pipes. 13. Ondansetron. Mechanism: 5-HT3 antagonist, blocks serotonin receptors in the CTZ. Indications: chemotherapy-induced and postoperative nausea. Side effects: QT interval prolongation and headache. Nursing process: monitor EKG in cardiac patients. Administer 30 minutes before chemo. NCLEX tip: the gold standard drug for severe nausea and vomiting. Memory trick: ondansetron: I'm on the dance floor, no nausea. 14. Metoclopramide. Mechanism: dopamine antagonist and prokinetic, increases GI motility. Indications: diabetic gastroparesis and nausea. Side effects: extrapyramidal symptoms, EPS, and tardive dyskinesia. Nursing process: monitor for lip smacking, tongue protrusion, or puffing of cheeks. NCLEX tip: used to quickly empty the stomach before emergency surgery. Memory trick: metoclopramide, prokinetic, moves food. 15. Promethazine. Mechanism: antihistamine and dopamine blocker. Indications: nausea, sedation, and motion sickness. Side effects: severe sedation and respiratory depression. Nursing process: vesicant, administer via large bore IV or IM only. NCLEX tip: extremely high risk for tissue necrosis if the IV line infiltrates. Memory trick: ProMZs, makes you very sleepy. 16. Scopolamine. Mechanism: anticholinergic, blocks acetylcholine in the inner ear. Indications: motion sickness and terminal, death rattle, secretions. Side effects: dry mouth, blurred vision, and urinary retention. Nursing process: apply the transdermal patch behind the ear 4 hours before needed. NCLEX tip: replace the patch every 72 hours. Avoid in patients with glaucoma. Memory trick: C-polamine, for seasickness. 17. Aprepitant. Mechanism: substance P, neurokinin-1 receptor antagonist. Indications: prevention of delayed nausea from chemotherapy. Side effects: fatigue and liver enzyme elevation. Nursing process: used in combination with 5-HT3 blockers like ondansetron. NCLEX tip: can decrease the effectiveness of oral contraceptives. Memory trick: aprepitant, pre-treats nausea. 18. Bismuth subsalicylate. Mechanism: adsorbent and antimicrobial properties. Indications: diarrhea and H. pylori treatment. Side effects: black tongue, stool and tinnitus, ringing in ears. Nursing process: contains aspirin, do not give to children, Reye's syndrome risk. NCLEX tip: educate patients that black stools are a normal side effect, not melena. Memory trick: bismuth equals black stools. 19. Psyllium. Mechanism: bulk forming laxative, absorbs water to increase stool mass. Indications: constipation and diverticulosis. Side effects: GI obstruction if water intake is insufficient. Nursing process. Mix with 8 ounces of water and drink immediately. NCLEX tip. The safest laxative for long-term daily use. Memory trick. Pulls water into the stool. 20. Docusate sodium. Mechanism. Stool softener. Lowers surface tension of the stool. Indications. Prevention of straining, post-MI, post-surgery. Side effects. Mild abdominal cramping. Nursing process. It does not stimulate a bowel movement, it only makes it softer. NCLEX tip. Give with a full glass of water. Memory trick. Docusate drops the surface tension. 21. Bisacodyl. Mechanism. Stimulant laxative. Irritates the bowel to trigger peristalsis. Indications. Bowel prep for surgery and acute constipation. Side effects. Severe cramping and electrolyte imbalance. Nursing process. Do not use daily as it leads to bowel dependency. NCLEX tip. Works rapidly, usually within 6 to 12 hours. Memory trick. Bisacodyl blasts the colon. 22. Lactulose. Mechanism of action. Hyperosmotic, ammonia reducer. Indications. Hepatic encephalopathy, constipation. Side effects. Diarrhea, expected, flatulence. Nursing process, considerations. Goal, 2 to 3 soft stools per day. Monitor mental status. Memory trick. Lactulose loses the ammonia. NCLEX tips. Effectiveness equals improved orientation, less ammonia. 23. Magnesium citrate. Mechanism. Strong osmotic laxative. Indications. Rapid bowel evacuation before procedures. Side effects. Dehydration and cramping. Nursing process. Best served chilled to improve the metallic taste. NCLEX tip. Monitor for signs of electrolyte depletion after use. Memory trick. Citrate clears it out. 24. Polyethylene glycol. Mechanism. Osmotic laxative, pulls water into the colon. Indications. Chronic constipation and bowel prep. Side effects. Nausea, bloating, and flatulence. Nursing process. Dissolve powder completely in any liquid, juice, water. NCLEX tip. May take 2 to 4 days to achieve full therapeutic effect. Memory trick. PEG pushes the water. 25. Sulfasalazine. Mechanism. 5-ASA. Inhibits prostaglandin synthesis in the gut. Indications. Ulcerative colitis, UC, and Crohn's disease. Side effects. Orange-yellow skin, urine and photosensitivity. Nursing process. Encourage high fluid intake to prevent kidney stones, crystalluria. NCLEX tip. Check CBC. It can cause bone marrow suppression. Memory trick. Sulfasalazine, salicylic acid derivative. 26. Mesalamine. Mechanism. 5-aminosalicylate anti-inflammatory. Indications. Maintenance therapy for ulcerative colitis. Side effects. Headache and abdominal pain. Nursing process. Often administered via enema or suppository for localized effect. NCLEX tip. Better tolerated by patients than sulfasalazine. Memory trick. Mesalamine, mesa, equals table, brings peace to the table. 27. Infliximab. Mechanism. TNF inhibitor, biologic. Indications. Severe Crohn's or ulcerative colitis. Side effects. Infusion reactions and increased risk of serious infections. Nursing process. Must have a negative TB skin test before therapy starts. NCLEX tip. Avoid live vaccines during treatment. Memory trick. Infliximab. Inflicts pain on inflammation. 28. Adalimumab. Mechanism. TNF-alpha blocker. Indications. Crohn's disease. Side effects. Injection site redness and increased infection risk. Nursing process. Teach the patient proper subcutaneous injection technique. NCLEX tip. Monitor for fever or any signs of latent infection. Memory trick. Adalimumab. A for autoimmune. 29. Dicyclamine. Mechanism. Antispasmodic, anticholinergic. Indications. Irritable bowel syndrome, IBS, cramping. Side effects. Dry mouth, constipation, and urinary retention. Nursing process. Contraindicated in patients with BPH or glaucoma. NCLEX tip. Relaxes the GI smooth muscle to stop the spasm. Memory trick. Dicyclomine. Stops the cycles of cramps. 30. Allosetron. Mechanism. 5-HT3 antagonist specific to the GI tract. Indications. Severe IBS with diarrhea, IBSD, in women only. Side effects. Ischemic colitis. This is a medical emergency. Nursing process. The patient must sign a legal waiver, REMS program. NCLEX tip. Stop the drug immediately if constipation or rectal bleeding occurs. Memory trick. Allosetron. Sets the diarrhea to stop. 31. Linaclotide. Mechanism. Guanylate cyclase C agonist. Indications. IBS with constipation, IBS-C. Side effects. Severe diarrhea. Nursing process. Take on an empty stomach, 30 minutes before breakfast. NCLEX tip. Increases the amount of fluid secreted into your intestine. Memory trick. Linaclotide. Clots of water in the gut. 32. Pancrelipase. Mechanism. Enzyme replacement, lipase, protease, amylase. Indications. Cystic fibrosis and chronic pancreatitis. Side effects. Greasy stools, stearia, if the dose is too low. Nursing process. Must take with every meal and snack. NCLEX tip. Effectiveness is shown by weight gain and improved stool consistency. Memory trick. Pancrelipase, for the pancreas. 33. Ursodiol. Mechanism. Decreases cholesterol content in bile. Indications. Dissolving cholesterol gallstones. Side effects. Back pain and GI upset. Nursing process. Requires long-term therapy, up to 2 years. NCLEX tip. Do not take simultaneously with aluminum-based antacids. Memory trick. Ursodiol. Gall be gone. 34. Cholestyramine. Mechanism. Bile acid sequestrant. Indications. Pruritus, itching, from biliary cirrhosis. Side effects. Constipation and fat-soluble vitamin deficiency, A, D, E, K. Nursing process. Mix with juice, water. It can cause tooth decay if sipped. NCLEX tip. Take other medications 1 hour before or 4 hours after this drug. Memory trick. Cholestyramine. Collects the bile. 35. Rifaximin. Mechanism. Non-systemic antibiotic. Indications. Traveler's diarrhea and hepatic encephalopathy. Side effects. Flatulence and nausea. Nursing process. Kills ammonia-producing bacteria in the intestinal tract. NCLEX tip. Not absorbed into the bloodstream. Works only in the gut. Memory trick. Refines the gut flora. 36. Senna. Mechanism. Stimulant laxative. Indications. Acute constipation. Side effects. Melanosis coli, brown lining of colon. Nursing process. Harmless discoloration of urine, brown, pink. NCLEX tip. Commonly paired with docusate, known as mush and push. Memory trick. Senna sends it out. 37. Simethicone. Mechanism. Antiflatulent. Breaks down surface tension of gas bubbles. Indications. Gas pain and post-operative abdominal distension. Side effects. No significant side effects. Nursing process. Chew tablets thoroughly. Take after meals and at bedtime. Memory trick. Simethicone. Cones the bubbles together. 38. Aprepitant. Mechanism. Substance P, neurokinin-1 receptor antagonist. Indications. Prevention of delayed nausea from chemotherapy. Side effects. Fatigue and liver enzyme elevation. Nursing process. Used in combination with 5-HT3 blockers like ondansetron. NCLEX tip. Can decrease the effectiveness of oral contraceptives. Memory trick. Aprepitant. Pre-treats nausea. 39. Lubiprostone. Mechanism. Chloride channel activator. Indications. Chronic idiopathic constipation and opioid-induced constipation. Side effects. Nausea and headache. Nursing process. Take with food and water to minimize nausea. NCLEX tip, specifically used for women with IBS constipation. Memory trick. Lubiprostone, lubricates the stool. 40. Dronabinol, mechanism. Cannabinoid, activates CB1 receptors. Indications. Chemo, nausea and anorexia, weight loss in HIV, cancer. Side effects. Tachycardia, dissociation, or high feeling. Nursing process. Monitor for the munchies, increased appetite. Avoid alcohol. NCLEX tip, often referred to as the medical marijuana pill. Memory trick. Dronabinol. Think of droning or being high.
You got me loser, set me free.